It's once again time for flu shots, just as the country is gearing up for COVID-19 boosters. So should you get the shots together or time them out a few weeks apart? The Fox Medical Team's Beth Galvin joins us live to talk about this. Good morning, Beth.
And good morning, Kristen.
So there's lots to talk about. How quickly should we be trying to get a flu shot?
Well, the CDC typically recommends that everybody who can get the flu shot get it by about 6 months who is 6 months or older, get the flu shot by the end of October. So, it would make sense right now with the COVID-19, sort of making the rounds with RSV, the respiratory virus, very common in young children, making the rounds, that people go ahead and get the vaccine as soon as they're able to get it in the next few weeks. I think as long as you get it sort of by the end of October, Kristen, you should be okay.
Can someone get, and should someone get, a flu shot and a COVID-19 shot on the same day?
So the CDC says that you can either get, your initial vaccine for COVID-19 and the flu shot, or get your booster shot if we're going to get booster shots, if they decide that. They say early on in the, in the rollout of the vaccine, they ask people to space it out and have their other vaccinations done on separate days, maybe 2 weeks apart from their COVID-19 vaccine, to make sure that they had a good grip on, what to expect in terms of side effects. Now they feel like, now that several 100 million Americans have had the COVID-19 shots, they feel like they understand the side effect profile, and they don't feel like you're going to get too many negative side effects at one time if you get both shots at once, and it may be more convenient. But that said, Kristen, if you don't feel comfortable about getting both shots at once, you can spread them out. There's nothing wrong with that. That is an option too.
Now, flu and COVID have a lot of the same symptoms. Is there a way that we can tell them apart?
It's hard if you have it, because they both can make you pretty miserable. The one sort of unique feature about COVID-19 is that you can often lose your sense of smell, lose your sense of taste. But, there are flu tests for the flu. There are COVID-19 tests that you can take. If you find yourself thinking that you've got one or the other, it's probably the safest option, Kristen, to go ahead and get tested and to isolate until you know exactly what it is that you have, and then sort of take things from there.
That's great advice, Beth. Thank you so much for joining us this morning.
Thank you.